Welcome back, viewers, to IPC with Nikki. We are starting certification preparation part 2. Our topic today is risk factors that facilitate transmission of infections. Duration of exposure. This is the length of time a person is exposed to an organism. Imagine infectious agents are new diseases or strains of existing diseases. For mites are inanimate objects and they can cause the spread of disease. Infectious agents are microorganisms, bacteria, viruses, fungi, or parasites, and they cause disease or infections. Infectious disease are illnesses that spread from one person to another, while infectivity is the ability of a microorganism to enter the tissue. Basic terminologies are very important in infection prevention and control. Continuation, we have pathogenicity. Pathogenicity is the ability of a pathogen to cause diseases. We have microbiomes, microorganisms, bacterial, viruses, and fungi, which live on or in our bodies. Microorganisms are microscopic infectious agents such as viruses, bacteria, fungi, or parasites. The mode of transport is how an infectious agent or pathogen transfers to a host. A pathogen, again, is an infectious agent that can cause diseases. Basic terminologies continued. Pathogenicity. This is the ability of a pathogen or an infectious agent to cause diseases. It is very important to know the difference between pathogenicity, infectivity, and other terminologies. Personal protective equipments include gloves, gowns, masks, goggles, respirators, or face shields that are worn as a barrier to exposures to infectious agents. The portal of entry is the route through which a microorganisms get into a host, while portal of exit is the route through which they leave the host. A reservoir is a place where microorganisms can survive until they find a suitable host. Terminologies are very important in understanding infectious diseases and its control. As mentioned earlier, there are a lot of terminologies that can help us understand. Others include size of inoculum, number of organisms needed to cause the disease. A susceptible host are usually persons who are at risk of infection, e.g., immunocompromised individuals, the aged, and other persons with certain disease conditions. Transmission-based precautions are measures put in place to prevent spread of disease. They include contact, droplet, or airborne. Vectors are living organisms that can transmit diseases, e.g., mosquitoes, ticks, or bites. Another important factor or terminology is the chain of disease transmission, which are the events that take place for infections to spread from one person to the other. It starts with the infectious agent. Next is the reservoir, such as animals, insects, people, water, soil, dirty equipment or surfaces. Next, portal of exit, which is the broken skin, open wounds, body fluids, and aerosols. Next is the mode of transmission, contact or direct or indirect contact, ingestion or inhalation. Next is the portal of entry into another host, and next is the susceptible host. Causes or factors that increase disease transmission, medical interventions can increase disease transmission, such as length of stay in hospital, invasive procedures, prolonged use of antibiotics and other medications. Other high risk procedures, indwelling catheterization, mechanical ventilation, central intravascular access, invasive surgical procedures, parenteral nutrition, intracranial monitoring, oxygenation, hemodialysis, ventricular assisted devices, and so much more. Patient factors like immunosuppression, pregnancy, severe burns, malignancy, trauma, disease state, and nutritional status are all factors that contribute or increases the risk of disease transmissions. Now, understanding these risk factors can help in putting on measures that can help prevent spread. Residency of group homes, such as long-term care homes and nursing facilities, age, travel history, occupation, and exposure to reservoir of infectious agents are other patient factors that can increase the chances of disease transmission. How do we mitigate against these factors? One, prompt identification through testing, active surveillance can help to identify these infectious diseases. Immunization of personnel working in healthcare facilities, restriction of personnel with transmissible infections, monitoring and following up on personnel exposure to infectious diseases. These are ways that we can curtail spread within personnel or healthcare associated infections. Other reduction measures include restricting visitation in high risk areas, especially in outbreak areas, cohorting of patients or residents with infectious agents, improving the hygiene of residents or patients, which in turn will reduce microbial load, patient resident education, prompt isolation of residents. That is immediately isolating residents with transmissible infections when the need arises. For further readings, please visit Epic Text Online, Chapter 21. Thank you and join us.